Hi, everyone. I hope you're doing well today. It's on. It's just, I have to talk really close. Hi, all. My name is Quinny. I use she, her pronouns. And I've been working in digital health for the past 4 years. And our panelists here represent a variety of roles and sectors that use digital health. And what we really wanted to do today was to have a conversation with you on technology and its role in promoting health equity, because we believe that technology is a tool that can leverage not just our access to our friends and our access to different opportunities around the world, but it can actually be a tool that improves our community's health. And understanding BIPOC communities, we're well aware of the inequities that exist within our communities, and that's why it's incredibly important for technology to include initiatives for our communities and also to be implemented departmentally in a way that caters to us. So I'm going to give our folks a second to introduce themselves. Christian, do you want to start us off?
Absolutely. Thank you. Good afternoon, everyone. I'm Christian Jocelyn. He, him pronouns. I serve as the VP for Digital Enterprise Operations at Northwell Health in New York. We're a large health system in the New York area, almost 90,000 employees, 21 hospitals. And I'm responsible for our shared service function for our technology group at Northwell, which is about 2,000 employees. And I oversee our finance teams, project management, portfolio management, contract vendor management, all the fun stuff.
And Christian, a follow-up question. What got you into digital health as well? What got you into health tech?
So I actually started out my career in healthcare as a clinician. I was a paramedic, and I transitioned into sort of the business operations side, and I was afforded this opportunity about 1.5 years ago to build this shared service function within our health system.
Thank you, Christian.
Hi, everyone. Hi. Can you turn my mic on? Testing, testing. It is on. Woo! It's hot. All right. Hi, everyone. I'm Jessica Tsadwa. I use she, her pronouns, and I'm the program manager for inclusion strategy at Doximity. My work focuses mostly on our internal DEI work, so I support all of our employees. I work with our ERGs. I work on benefits and company culture, things of that sort. How I got into digital health is very non-traditional, I would think. My entire background is in education, so I'm a PhD. I worked in higher ed, and that work was really meaningful, and I was searching for something that was flexible but made a larger impact, and I found Doximity and this team with Felix, and it has given me the chance, I think, to expand beyond just working in like one university system. Now I can impact an entire industry.
All right, my mic's on. Okay, so hi everyone. My name is Felix Chanea. My pronouns are he, him, el, depending on the language that you're speaking. I am the Director of Health Equity and Inclusion Strategy at Doximity. Doximity is a professional social media network for clinicians that is the largest medical network. We have about 80% of US physicians on our network, about 50% of nurse practitioners and physician's assistants. So in addition to being that medical network, we also offer a suite of product tools that are geared towards helping clinicians in their clinical workflow be more efficient and be more productive. So I've been in my role for about 3 years. The way I got into health tech was through a clinical route similar to Christian, where I am a physician by training. I spent years doing healthcare research, specifically health equity research in the Latinx community, and prostate cancer, and I decided for myself that I wanted to stay that kind of data-driven approach to making a larger impact in healthcare, but I wanted something a little bit more fast-paced. And felt like tech was the route for me, and so I made my way to Doximity into this role now.
Thank you all. And just for context, I have been working in startups, but my context, I came from a background in religion and a master's in social work. And we're going to talk a little bit more later about how we can bring in these different perspectives into health tech. But one of the things that I want to do when we start this conversation is really define inclusion. Inclusion is a word that is being used a lot, and in equity, some organizations say it, but like they're not actually putting it into place. So I want to ask y'all specifically, how are you defining inclusion, especially in terms of health tech or digital health? And what is required for tech to benefit people of all backgrounds?
All right, so I'll start. So the way I would define inclusion as we're thinking about health tech, so these are companies that are building digital products to help patients and serve within the healthcare space. So I think as we're thinking about building these digital products, we need to be very intentional about the way we design them and making sure that that has inclusivity in mind. So we're thinking about the accessibility of the products. Are you thinking about the way we design this is accessible to folks of all abilities? Are we thinking about the types of communities that we're engaging with? The fact is, are we building the types of products and solutions that are actually relevant to communities? Are you outreaching communities and actually co-designing these solutions with them so that you can make sure that you're building relevant products that actually serve the needs that they have, and that you actually have a back and forth conversation about what those needs are and what they may be in the future and how they may change? All those things are incredibly important, and also thinking about the diversity of the teams that you have on board within your company. That influences the type of solutions and decision making that happens along the way as you build these products, and shapes how inclusive those things can be.
Jessica, I want to ask you this question as well. How do you define inclusive technology in relations to health? And what does that look like from like a sales or marketing perspective at your company?
Yeah, so I would say for the defining it piece, it's about paying attention to not only who is present, but who is not present at every stage in the process. So including folks in your thinking is not enough. It has to be including people in your process as well. So at every single stage, thinking about, again, who's present and who is not. And I think from a sales and marketing perspective, we think about it in a pipeline almost. So we primarily work with physicians, right? But we also have companies that want to market and advertise to our physicians on our platform. And then we have patients who are served by those physicians that we have to think about too. And so we have to think about each stage in the process, who's being impacted, how that trickles down. So when we're thinking about who we want to work with in terms of advertising, that makes a difference in how our physicians are going to serve their patients. So it's always about, I think, paying attention at each step. We can't just say we're inclusive because we think about these identities. It's at every single stage of what you're doing, it makes a difference in the outcome for the people that work at your company, the people you serve, the people those people serve. That to me is a real inclusive lens.
Thank you. And Christian, I'm going to ask you the same question, but I really want to get your point of view because you are in a medical building facility. What is imperative for inclusion in technology in those settings? And from a project management perspective as well.
I think, provider organizations like Northwell, we're a little late to this party. We've spent so much time focusing on the care that we're actually providing, having the best facilities, hiring the best physicians, making sure we have nurses. But now, especially thanks to the work that's happening in the marketplace with folks like Doximity and others, we have to catch up with the experiences that we all enjoy in all other aspects of our lives. I mean, how many of you, go to your physician's office and they're asking you to fill out the same exact form over and over and over again? Or, they're introducing a digital experience for you, and for most of us here that work in tech, you're like, oh, I would have never designed this way, or this doesn't fit my work or my lifestyle. Like, what about this patient population? How are they ever going to access it? And I think the work that we're doing at Northwell is trying to make sure that we're bringing in the talent and we're changing our focus to make sure that we're designing for all and we're not leaving anyone behind. So we're late to the party. We're trying to catch up and really catch up with everything else that's happening out there in the world.
Thank you all. I think one thing I like to add to conversations revolving around health and technology is no one wants to talk about health. It feels like a very unsexy topic. A lot of us, when we think of tech, we think of like Facebook or Meta, or I don't know, what are the other big things? TikTok. Yes, exactly. So I think a lot of times those things can be really fun, but sometimes a lot of us really want to do meaningful work. And there is so much room here. But we are also in an era where DEI and these kind of inclusion efforts are being attacked. And so I want to hear from y'all, like in this age of disruption, where we feel like people don't want to have these conversations, how are you and your companies upholding DEI? And where are your companies aligned with mission? And I think another thing to kind of play in here is, how does this differ from what other sectors within tech are doing?
I'm happy to start here. So, I'm fortunate that I work for a very mission-driven company. A lot of the work that we do, we're a nonprofit. We serve about 12 million people in the area, but a lot of the work that we do speaks directly to our mission. So I'll give an example. Mental health. Mental health from a reimbursement perspective or a straight economic perspective, it loses money for most health systems. But Northwell provides mental health care, by the most mental health care in the New York market by far, so regardless of your ability to pay. So I think a lot of the work that we're doing is we're making these investments in things that serve our patients, our communities, and looking to bring digital technologies to the table that further sort of expand the reach out into these communities. So, a lot of the things that we're doing is, how do we take these digital tools that we're purchasing or even developing and making sure that they're being embedded in the programs and the places that advance care for our community. We have a program that we started a couple years ago for homebound patients, and a lot of the homebound patients in some of the Northwell markets are, Black and brown folks. To better provide care to these patients who can't leave the house to go see their doctors, we're bringing pretty advanced telehealth tools, diagnostic tools into the home, making sure these patients have access to it, and that there isn't a disparity in the types of care that they can, the disparity in their care. So I think that's a lot of the things that we're doing at Northwell to sort of converge the two, and it's something our CEO talks about, and it's something we try and embed in our culture.
Yeah, the way that I like to think about this is, like, oftentimes when you talk about equity and inclusion and incorporating it into companies, people talk about the business case or the moral case. And I feel like there's a middle ground or something in the middle there that's oftentimes missing, which is the mission case. And Christian kind of alluded to it, of like aligning this work with the mission of the organization. So what does that mean? That means, like, at a company like Doximity, where our mission is to make physicians' lives easier or make their lives more productive or make their work more productive, we have to be sure that when we're thinking about equity and inclusion, we're applying it to the products that we actually build. So it's in alignment with the work that we do. That way, when teams have incentives and have goals quarter by quarter, and you apply an equity and inclusion lens to those goals, it's in alignment with the mission, and it's not considered a side project or a charity project that it tends to lose resources over time. So what does that mean in terms of like product development? Earlier I mentioned the term co-designing products or engaging with communities. So we have a telehealth product called Dialer, or Video Dialer. It is included in 3 different tiers. There's a free service, there's a Dialer Pro service, and there's a Dialer Enterprise service. The Dialer Pro and Enterprise are both paid for services. So when we started this telemedicine product back in early on in the pandemic, we gave it free to everyone. All of those services were free. And then when we transitioned into actually charging for that telehealth product, we had free clinics reach out to us and say, we're using Dialer, it's very useful to us, but we can't afford it. So we created a pathway for free clinics to actually use Dialer for free. Now, when I took on my role, it was still pretty hidden in our FAQ page, but I explored the possibility for us to expand that service and work more with free clinics through our telehealth product. We started growing that, and we have about 70 free clinics on board right now working with us. Now, we develop relationships with those free clinics. Some of them have used us for over 3 years at this point, and that creates a communication channel where we can get feedback on how they use our product, which features are useful, which ones are not useful, what needs to be better, and we can communicate that with our product teams. So that's a way to engage with community members that are oftentimes coming from historically marginalized communities, often underserved, often don't get their voices heard in these tech companies, and creating a structured, strategic way to incorporate that feedback in the product design.
What I'm hearing a lot here is it had to start from the top down. Like there was a mission that was very clear that said we want to serve all communities, and that means we have to do this in a way that's comprehensive. And so while DEI might be in a space of vulnerability, in the spaces that you're working in, it's a part of the strategy in itself. And I think for a lot of us that's a core part of us. Like we want to make sure that we're addressing diverse communities, or we want to be in a workplace that allows us to talk about those hard topics of equity and inclusion. Like a place that is mission driven is going to be a really beneficial place for you to work in. So in this point, like there might be a few of you that are like, okay, like health tech sounds cool, but I've never worked a day in healthcare in my life. Or I'm in healthcare, but how do I get into technology? And so I want to ask you, Christian and Jessica, what are ways that BIPOC or people with lived experience, I know for us it feels like a lot farther away because a lot of us have less family that are in medicine, or just like the stats that we see. So for BIPOC in tech, either with or without medical experience, what are ways that they can plug into digital health?
I was waiting for this question. So this is an area that I'm very, very passionate about. Let me just set the stage on what's happening at Northwell and a lot of large health systems. We're currently migrating out of our on-prem data centers into the Google Cloud. And that opens up a whole host of opportunities for folks that are cloud native, cloud engineers, and know how to work in these spaces. We're moving our entire enterprise onto Salesforce. And just think about the use cases for CRM that we've seen in multiple other industries, whether it be all of the retail industries, a lot of the consumer focused industries. Imagine if your healthcare provider had a CRM backbone, and imagine how much easier your life would be interacting with your provider. These are the types of strategies that we're moving forward. Yesterday, we had the AI leadership team from Google at Northwell talking through the roadmap that we're looking to pursue together. So I think now healthcare as an industry is finally catching up to what's happening across the multiple different markets, and there are less barriers to entry because now you have folks on our side of the coin that understand what your skill sets are, what you bring to the table. We're purchasing these platforms, and to top it all off is we are mission-driven organizations. You show up at a door of of most hospitals, clinics, health, you will never be turned away. Most hospitals in the country are nonprofits. They have to provide care for you, regardless of your ability to pay to maintain a lot of their tax status. What that means is the imperative is on us to make sure our workforce, top to bottom, reflects the patients and the communities that we serve. And I think that represents a unique opportunity for people who are mission-driven, who have these types of skill sets to come on to the other side and work on the provider side. Yeah, here's the other part. Healthcare is recession-proof. No matter what's happening in the economy, most people will always go to the doctor. And I think it's another really important part. So it's a topic that I'm passionate about, and feel free to find me on all the socials. I'm happy to talk through it with you guys more, but come on down, we're waiting for you.
I guess I would just say that I have a really non-traditional path. I didn't have a healthcare background when I joined Doximity, but I knew enough from my own experience being a patient before and what that's like. And so I think if you feel passionate about healthcare, if you feel passionate about the communities that you're from, find your entry point. There are non-technical roles that you could be in. I really respect and admire the things that you folks all do, but that's not what I do. I don't do that at all, right? But I brought my skills and my experience and found a way in where now I get to make a difference. So I would encourage you to think about what your pathway in might be, even if it isn't what you would hope for right away. Once you get in, you can develop those skills, you can network within the organization and figure out where you can make the most impact. But don't feel like you have to have it all sorted on your resume before you find a pathway. Find the pathway and then you can explore once you're in. The other thing, if I have time, that I would say is it's really, really important to not discount what you bring in terms of your identity. Don't undersell the value that you bring to an organization by simply being who you are and having the lived experiences that you have. You can speak to things that likely many people on the team that you're applying for cannot speak to. And so make sure you use that as a power when you're interviewing and applying for things, because it really is a value add to any organization that you're trying to join.
Amazing. Thank you both. I do want to ensure that before our panel ends, we have time to hear from the audience. Are there any audience questions that you'd like to ask our panelists today?
Good afternoon. Thank you so much for being here. So my question is, obviously healthcare is not an industry like any other. How are your organizations preparing to provide more care to the senior population that we're going to see booming in the next 5 to 10 to 20 years?
I mean, I'll start. I think a lot of what we're doing at Northwell, and you may even see this as you interact with your healthcare providers, is that there's less and less care that they're asking you to actually go to a facility and receive. Telehealth exploded in the early in the pandemic. There are multiple other care sites that are popping up, and what's being reserved for the hospitals and some of these more acute locations are the places that really, really sick people go. So I think what we're trying to do as an organization is make a shift towards wellness and more accessible wellness care that's more embedded in your communities and the ways we like to access our care. And these care environments that unfortunately, the burden of disease is on sort of the folks in that silver tsunami, the folks who have that burden of the disease, those folks who do need intense care, we do have the capacity for it in our facilities. And the other part of it too is that we're designing our facilities and our processes to make that care accessible for them. Again, talking about our lived experiences, a lot of us have probably been in these situations with are with some of the older members of our family. Are these facilities accessible? Are they built for our grandparents and my parents to access safely? You know, I serve as a translator for whenever my grandmother uses taps into the healthcare system. You know, you would think that we would have, and this is on us, that we would have much easier ways to provide at the bedside translation where, you know, I'm not in the position to do that. So I think there are a multitude of strategies that we're taking on the provider side to sort of rebalance where we're asking people to receive care, to accommodate sort of these population trends, but also making that care more equitable and accessible for those patients that we have to serve.
Do we have time for me to chime in?
We have 1 minute.
1 minute. I'll try to make it quick. Okay, so from the Doximity side, we think about this in a couple different ways, or I could put it in terms of like 2 of our products. So increasing access to care. So we have a telehealth product. Telehealth increased in adoption during the pandemic. It's still higher than it was pre-pandemic, although it's not at that peak. But telehealth provides an opportunity to, you know, have those less, because the same retirement issue is going to impact physicians as well. We're having less physicians as more physicians are retiring. So then you have the issue of specialty care, especially in areas like rural areas that they may not have a lot of specialists in there. Telehealth provides that access by allowing you to see a physician that's outside of your geographic location. So that's one thing, developing telehealth products that are useful, easy to use, and quickly get you into those conversations. At Doximity, I have a colleague here who's been reminding me we're #1 best in class, which means that we're the #1 used telehealth product out there. So having those sort of like agencies that are like actually measuring how well your product is used and is it providing a service to folks, that can be important, engaging all the different products that are out there. The other thing I will say is thinking about saving time for physicians. Physicians don't have much time to spend with patients. And so having clinical workflow tools that can actually save them time is incredibly important. We're diving into AI and using that as an AI scribe tool that we have that's able to document the conversation that's happening with patients so they can have a real human interaction with each other. And Doximity GPT also offers ways to cut through some of the paperwork like prior authorization forms that they spend a lot of time with instead of spending that time towards patient care. So increasing the amount of time that clinicians have can be a really big thing, and also increasing their reach through telehealth.
Amazing. Time is up. Thank you all so much for listening to our wonderful speakers, and I hope you enjoy the next panel.